Hi, my name is Tanisha, and today I will be presenting on how to predict response to chemotherapy in early-stage breast cancer patients. The goal of this study was to determine the effectiveness of the imaging studies done at the end of chemotherapy in accurately measuring the response to chemotherapy and its correlation with the actual response seen at the time of surgery. Also, the study focused on analyzing various patient and cancer characteristics to find out if any such variables correlate with the response. Traditionally, early breast cancers have been treated with surgery followed by chemotherapy. Research is now moving towards neoadjuvant chemotherapy or chemotherapy before surgery to help make surgeries more minimally invasive based off of the response to chemotherapy. My hypothesis was that imaging findings after chemotherapy will correlate to the amount of remaining cancer found at the time of surgery. My methods included gathering data on early stage breast cancer patients from January of 2015 to January of 2021 and analyzing this data. This is how I collected my results. From these charts, it can be determined that final imaging prior to surgery is able to show a correlation, thus enabling patients to get appropriate minimally invasive surgery. Few patients who did not have a radiological response can still have a favorable pathological response, meaning that no cancer was left at the time of surgery, even though it was shown on the final scan. Some patients, however, may still have cancer left at the time of surgery in spite of a good radiological response, meaning that the final scans before surgery showed minimal cancer, while when opened up, there was more cancer than anticipated. I also looked at 3 different subtypes of breast cancer: hormone receptor positive, HER2 receptor positive, and triple negative cancers. The results showed that HER2 positive patients had the highest pathological response to chemotherapy, while hormone receptor positive cancers had the least response. So overall, my hypothesis was correct because for the most part, final imaging findings did correlate with their final pathological response. This study is important because it can help oncologists predict response to chemotherapy given prior to surgery, but it also gives caution, as cancer may be left behind at the time of surgery and other treatments may be needed to reduce this risk of cancer recurrence. Also, omitting surgery after chemotherapy is not a good option. Here are my references, and thank you for listening to my presentation.